Hello, this is Dr. Najat Alzbeidi, specialist psychiatrist from Sheikh Khalifa Medical City at Behavioral Science Pavilion, Abu Dhabi, United Arab Emirates. On the behalf of my team, Dr. Amani Ibrahim, Dr.Ala Alnaqbi, Dr. Elbakhir Muhammad, Dr. Faisal Salman, and Dr.amna Almesmari, it is my pleasure to present this poster in such conference. It is a summary of our study that was conducted at Behavioral Science Pavilion in patient units. It covered the period when the lockdown due to COVID-19 pandemic was just announced and focused on characteristic of patients admitted to adult psychiatric unit in Sheikh Khalifa Medical City in Abu Dhabi during March to June 2020. Background. As we all know, psychiatric units are sites of accommodating and treating the most challenging patients, including those with acute state of serious mental disorders. Understanding factors correlate with psychiatric admissions, including patients' demographics and clinical characteristics, are paramount in recognizing patient needs and improving service provided to establish a management approach that is best suited for the local population. UAE is recorded to have the highest level of depression among all countries in Eastern Mediterranean region, according to a WHO report in 2015. This, in addition to what already has been known about mental health and its global burden, which explains the urgent need for UAE to assess the current level of mental health services for future planning and development. To the best of our knowledge, only 2 previous studies were conducted to investigate the psychiatric inpatient admissions in UAE. Moving to method, it is a retrospective examination of patients' file who were admitted to adult general psychiatric unit in Behavioral Science Pavilion, Sheikh Khalifa Medical City in the period between March to June 2020. Data extracted through defined variables, including age, gender, level of education, occupation, source of referral, presenting symptoms, diagnoses, therapeutic interventions, and length of stay, including criteria: adult patient above age of 18, patient with substance misuse disorder as comorbid to other psychiatric disorders, exclusion criteria: age below 18, case of pure substance misuse, and forensic cases. Results. 361 patients were admitted in that period. 63% were male and 36% were females. 75% of patients aged between 20 to 40 years old. 75% were Arabs, followed by 14.7% of Asians and 8% of Africans. 48% were single, 60% were uneducated, and only 7% had university qualifications. Reasons for admission were abnormal behavior in 33%, followed by aggression in 19%, and suicide attempts in 18%. Most frequent diagnoses were bipolar affective disorders in 30.5%, schizophrenia at 12.7%, and brief psychotic disorder in 12.2%. Moving to therapeutic intervention, most patients were treated with oral psychotropic with percentage of 94%. 5% were on depot injections. Among most frequent prescribed medications were antipsychotic medications, including olanzapine, a percentage of 13.9%, followed by quetiapine with a percentage of 8.6%. Anxiolytic also, as lorazepam was prescribed by 8%. Mood stabilizer as valproic acid was prescribed by 9.9% and lithium by 4%. Psychotherapy and ECT was only reported in 24.8%. This study conducted in the first few months of coronavirus. 5.3% of patients had history of coronavirus infections, and a significant correlation was found with past history of coronavirus infection and specific psychiatric illnesses, especially major depressive disorder, generalized anxiety, and PTSD. 27% of patients stayed from 5 to 10 days, where 21% stayed between 11 to 15 days. Results shown in the table and figures below. Moving to conclusion and recommendations, majority of patients were referred through emergency room Sheikh Khalifa Medical City. 75% of them were Arabs. Abnormal behavior, aggression, and suicidal attempts were the most common reasons for admission. Psychosis and bipolar disorders represent the most common diagnoses of patients admitted. Patient length of stay was up to 10 days, although we cannot conclude that this reflects regular situation, as it could be the result of coronavirus-related lockdown and safety measures in that period. A comparison study between period of coronavirus and the previous years before pandemic would be more informative upon the effect of pandemic on characteristics of patients admitted to psychiatric units. A significant correlation with past history of coronavirus infection and specific psychiatric illnesses was found, especially with major depressive disorder, generalized anxiety disorder, and PTSD. Thank you.